Unprotected sex by school-age teenagers is becoming a cause for concern. Data gathered by the National AIDS Program Secretariat revealed this worrying trend after 40,331 HIV tests were conducted nationwide between January and July of this year. National Voluntary Counseling and Testing Coordinator Deborah Success Hall stated that based on statistical data, teenagers from the age of 15 have been diagnosed with the virus.
Request is fulfilled, and so we'll be engaging on a few days of testing from today and until Sunday. So once again, thank you. Now, whenever we have this kind of activity, what we will engage is a group counseling for the purpose of time. So I'll give you the basic information that you need to know, and then I'll invite you to go with the counselors. These are all trained and certified counselors that will take all the persons who will be getting tested this morning through the process. And one of the things you know that once we are committed and demonstrate the political will, we'll be able to have a lot of persons following us. Now, when we look at our programmatic data, we are seeing that persons between the ages of 15 to 19 and 20 to 25 are infected. They are being diagnosed on a daily basis with HIV. And so we need to ensure that we do something urgently to ensure that we are able to decrease that.
The coordinator, in the presence of ministers, recommended to the authorities that a plan be drafted collectively with schools, the Ministry of Health, the Ministry of Education, and other stakeholders to address the issue. But as it pertains to the issue of persons indiscriminately infecting persons with the virus, NAP's program manager, Karen Boyle, explained that having the act deemed criminal is not on the agenda for the unit. She explained that while several countries have imposed penalties for the inhumane act, Guyana has taken a different approach with the issue.
So-called secondary prevention. So when someone is identified as being HIV positive, what we seek to do is to empower them to become partners with us to reduce transmission. So in other words, the person takes it upon themselves to be a partner in reducing spread. So they're empowered to think about their own bodies, to think about their own health, and they're taught how to care for themselves, how to take their medication, to be adherent. They're taught about planning for pregnancies, and all of the measures they can take, both in terms of their sexual behavior, their food, and healthy living. And the idea is that, as we mentioned before,
Guyana's rating among nations with high HIV/AIDS infections rates improved from number 2 to number 6 in the region. But despite that, Minister of Public Health Dr. George Norton made a call for Guyanese to practice safe sex and abstinence. Persons desirous of knowing their HIV status can visit 12 testing sites around Georgetown over the next 5 days. Javone Vickerie, HGP Nightly News.